Hello and thank you for watching our video on anesthetic considerations for patients with a history of respiratory diseases. During the administration of anesthesia, it is crucial to consider the patient's respiratory health as an anesthesiologist. In this video, we will discuss the difficulties of anesthesia management in patients with respiratory diseases, as well as the best practices for preoperative assessment, perioperative management, and postoperative recovery. Prior to any surgical procedure, a comprehensive preoperative evaluation of the patient's respiratory condition is essential. This involves evaluating the patient's medical history, including any respiratory conditions such as asthma, chronic obstructive pulmonary disease, COPD, or sleep apnea. It is essential to determine the severity of the patient's respiratory disease and to identify any potential stressor that may exacerbate respiratory distress during surgery. During the surgical procedure, it is crucial to preserve the patient's respiratory function while minimizing the risk of adverse effects and complications. This may entail a combination of pharmacological and non-pharmacological techniques, such as regional anesthesia or mechanical ventilation. To ensure adequate respiratory function, close monitoring of the patient's vital signs, including oxygen saturation and carbon dioxide levels, is essential. After a surgical procedure, the management of the patient's respiratory health remains an essential consideration. The objective is to reduce the risk of respiratory complications and maximize recovery. This could include oxygen therapy, respiratory interventions, and early mobilization. During the recovery period, it is essential to closely monitor the patient's respiratory function and modify the treatment plan as necessary. With proper preoperative assessment, perioperative management, and postoperative recovery, patients with a history of respiratory diseases can receive safe and effective anesthesia while minimizing the risk of respiratory complications. As an anesthesiologist, it is essential to collaborate with the surgical team and other healthcare professionals to ensure that the patient achieves the best possible outcomes. We appreciate your viewing and hope that you found this video informative and useful.